Welcome back to UC Davis Live. I'm Satirius Johnson. Millions of Americans have been vaccinated. Case rates have been falling nationally, including here in California, where officials lifted most pandemic restrictions on June 15th. So where are we now? Is the pandemic nearly over, or is it too soon to declare victory? What precautions should we keep in place? Joining us to discuss these and other questions are two people who have been at the forefront on the fight against COVID-19 in our region. Dr. Aimee Sisson has been public health officer for Yolo County since October. She was previously public health officer for Placer County and served as a public health medical officer at the California Department of Public Health for over 10 years. And Dr. Dean Blumberg is professor of pediatrics and chief of pediatric infectious diseases at UC Davis Health. His interests are in preventing and treating childhood infections, vaccine research, and childhood immunization policies. Thank you both for coming on today.
Thank you.
Thanks for having me.
Sure. So before we get started, just a reminder that this is a free webcast. You can watch it live and watch it after the live broadcast on the UC Davis Facebook, Twitter, and YouTube channels. We are aware of others posting links saying that you have to pay to watch this video. Please do not click on those links. This is a free webcast. And of course, we are taking audience questions. So if you're watching us live, just leave them in the comments section and we'll work in as many as we can. Dr. Sisson, let's start with you. What is the state of the pandemic in Yolo County right now?
Yeah, when we look at our numbers of COVID-19 cases and our testing positivity, they are very good. If we were still under the blueprint system, we would be in the yellow tier. Our adjusted case rate is 0.8 per 100,000. Our unadjusted case rate, so that doesn't take into account the very large testing volume that we have in Yolo County, thanks to Healthy Davis Together and UC Davis testing. That unadjusted case rate is 1.7 per 100,000, which ends up being about 4 cases, somewhere between 3 and 4 cases that we're averaging per day of new infections. For context, that's the lowest we've been in terms of new cases since March of 2020 when the pandemic was just beginning. So we've really seen a turnaround and a decline in our case numbers thanks to the large number of residents of Yolo County who are fully vaccinated.
Is it possible that the kind of over representation of the Davis numbers or maybe skewing the county numbers in some way? Is that taken into account? Is it possible that, the area of Yolo County that encompasses Davis and maybe the surrounding area might be kind of skewing the numbers more positive, positively in a good way than maybe the other parts of the county?
Yeah, we do see that when we break down we did an analysis recently of new cases in the month of May and the first half of June by census tract. And we do see some areas of the county where, if they were their own counties under the blueprint, that they would be purple. We have a couple of census tracts that look like that. But by and large, most of the county would be in yellow or orange. But certainly the county average of cases and the testing positivity, as I already mentioned, are positively affected by the large volume of testing and the very high compliance that we've seen with restrictions in the Davis area.
And how do you see the trends locally, whether county level or even just the region and then statewide as well? How are you seeing the trends?
Yeah, Yolo County, for a lot of the pandemic, has led the region in terms of having lower cases than the greater Sacramento region, and now with vaccines having a larger proportion of our population vaccinated. That being said, when we compare the greater Sacramento region to the overall state, we are somewhat lagging behind, particularly when it comes to vaccinations, and we are also a little bit, higher in our case rates compared to the state average. So Yolo County doing better than the region, but in general not doing as well as the state, at least when it comes to vaccines. We have, using the state's numbers, we have 65% of those over 12 who are vaccinated compared to the state, which is at 67%. So very close, but slightly behind that state average.
Right. Again, we are taking audience questions. So if you're watching us live, just leave them in the comments section and we'll work in as many as we can. Dr. Blumberg, how do things look at the UC Davis Hospital now?
Things are good. We had a lot of COVID patients last year during the pandemic. We've had a lot of admissions in the pediatric area for the MIS-C, the multisystem inflammatory syndrome in children that occurs after infection. Right now, there's very few cases who are being admitted for acute COVID. There's very few post-infectious complications. Things are looking good.
And so how do you see the trends this summer? I know there's this new Delta variant that people are worried about. How are you seeing things moving forward this summer?
Well, the expectation is that the summer should be a good time for us. We know that these viruses are traditionally transmitted more in the winter, that the temperature and humidity favor transmission during the winter. People are more crowded and indoors during the winter, so summer should be a better time. But as you mentioned, the variants, they're a wild card. You know, the Delta variant is about 90% more transmissible and results in about twice as much hospitalization compared to previous circulating strains. And so that's a real concern. And right now, there's not that much of it circulating in California in general or in Northern California, but the proportion is increasing.
Right. And as far as trying to keep that, say out of the country or tampered down, is there any way when, like with these usual tests, there's no way of knowing that, okay, that's the variant that person has at this point, right?
No, the virus, the isolate needs to be sequenced. So that's done at a higher level. So public health is doing that so that we have good data on that. But there's no way of knowing just from the routine swabs that are done whether you have the variant or not.
So I guess, oh, please.
Oh, I was just going to chime in there and say a little bit, put the Delta variant in context in Yolo County. The Delta variant is here in Yolo County. We've had, I think, 14 cases now that have been detected through the UC Davis Genome Center. The great thing about the UC Davis Genome Center is they do sequencing of every positive specimen that's collected on the UC Davis campus, as well as through the Healthy Davis Together testing, which goes outside the city of Davis and really covers a lot of Yolo County now. So we've seen in the last couple of weeks that about half of the cases that are being detected through the UC Davis Genome Center are the B1617.2 or the Delta variant, also known as the Indian variant. And then the other half are the B117 or Alpha or UK variant, depending on which set of nomenclature you want to use. I think the good news about the Delta variant, based on studies out of England and Scotland, have shown that the vaccines continue to work very well against the Delta variant. But as Dr. Blumberg pointed out, it is more infectious and can cause more severe disease. So we do worry about the Delta variant, particularly in those who are unvaccinated, including children under 12 who aren't able to be vaccinated yet.
Right. And just remind us, when a person tests positive, what then happens?
Yeah, from a public health perspective, when a person tests positive, they need to isolate for 10 days, at least 10 days, depending on whether they had symptoms or not. So if they had symptoms, then it's 10 days from when their symptoms started. And then before they can be released from isolation, which essentially just means staying at home and staying out of contact with others, they need to have not had a fever for at least 24 hours without any fever-reducing medications. And then the rest of their symptoms need to be improving. For someone who never had symptoms, it's just 10 days from when their positive test was collected that they need to isolate. And then they don't need a negative test. They can go back to work, to school, and their normal life. Somewhere in that 10-day window, hopefully early in that window, they will be contacted by someone from public health to explain the process of isolation, and also to do what we call case investigation and contact tracing. So we'll ask, where they've been, who they've come in contact with, and it's only so we can notify those people that they may have been exposed to the virus and recommend that they quarantine if they aren't fully vaccinated.
Right. So that has not changed. That has stayed the same. In all of like the headlines that California is reopening, sometimes people hear that things are over, but things are not over. Just some of the restrictions have been eased.
Yeah, that's absolutely correct. What I like to say is, the blueprint may have ended, the blueprint may have gone away, but the virus has not gone away. We still have COVID circulating in Yolo County, and particularly those who are unvaccinated are vulnerable to infection and potentially hospitalization and death. So, I continue to strongly recommend that everybody get vaccinated because the virus has not gone away.
Right. So, and on that point, so basically, for someone who has not been vaccinated, essentially nothing has changed from, say, the early days of the pandemic. They are just as vulnerable to getting the virus and then also getting severely sick from the virus.
That is correct. I mean, one thing that has changed is as we've learned more about the virus and the environments in which it is more likely to be transmitted, we've been able to loosen some of the requirements for those who are unvaccinated. So for example, with this transition to what the state calls beyond the blueprint, or others just call the reopening of California, we no longer require those who are unvaccinated to wear masks outdoors, even when they're in crowds. So that is a change, because we now understand the significantly elevated risk in indoor settings, but outdoors where you have a large volume of air in which any virus that's present could be diluted, it is now considered safe for people who aren't vaccinated to take their masks off outside. But they do need to continue to wear masks as protection for themselves and for others when they're indoors.
Okay, so let's go over, since we're there, let's go over that again, because there's been a lot of confusion between what the CDC has been recommending. Cal OSHA has some other rules they were deciding on. So right now, post June 15th in California, just reiterate exactly the indoor, the outdoor, like what should people be doing right now?
Well, I can tell you what the rules are right now, and they're probably going to change tonight or tomorrow morning because Cal OSHA is meeting today, and the governor is probably going to issue an executive order either today or tomorrow. But I'll speak for 11:14 a.m. on June 17th, and that is that there are some settings in which fully vaccinated people need to continue to wear masks. So settings in which all people need to wear masks, and those are indoor settings that are considered higher risk. It includes healthcare settings because there are more vulnerable people seeking care in those settings. Also public transportation. So if you're in a taxi, if you're at an airport, you'll need to be wearing a mask regardless of your vaccination status. Also in K through 12 educational settings, because children are not able to be vaccinated yet if they're under 12, although that guidance may change again as the CDC is expected to issue revised K through 12 guidance in the coming weeks. Also in correctional settings or in shelters, including cooling centers. So those are settings where everybody needs to continue wearing a mask indoors. Other than that, fully vaccinated people do not need to wear a mask indoors. So if you're going to the grocery store, you can take that mask off if you're fully vaccinated. Unvaccinated people need to continue to wear masks indoors, but not outdoors. In terms of physical distancing, that is no longer required in really any setting, except for in the workplace. And this is where we get to the confusion between the two entities that issue guidance at the state level, the California Department of Public Health and Cal OSHA. So for the time being, Cal OSHA requires all workers in non-healthcare settings that are subject to what they call their emergency temporary standards for COVID-19 prevention. All of those workers need to wear masks regardless of their vaccination status, and they need to continue to stay at least 6 feet apart from coworkers and members of the public. However, Cal OSHA Standards Board is meeting today. They're expected to adopt a revised set of emergency temporary standards that would align with the California Department of Public Health face covering and beyond the blueprint guidance for distancing. So hopefully starting tomorrow, when the governor issues an executive order to put these hopefully newly approved standards into effect immediately, workers will not have to wear masks if they're fully vaccinated, and they won't need to distance. Let me just say one more thing in terms of verification of the vaccination status and the sort of enforcement for unvaccinated unvaccinated people. There's a few options for businesses that are open to the public. They can just put out signs that prominently display the requirement for unvaccinated people to wear masks, and then let people, quote unquote, self-attest through their behavior. They could station someone at the entrance to ask about vaccination status and require those who are unvaccinated to wear a mask. They could actually ask for proof of your vaccine, or they can require everyone to continue wearing masks. So those are the options for businesses interacting with the public. And then for employers, they are allowed to ask their employees about their vaccination status. They need to ask their employees about their vaccination status because it determines whether they need to quarantine after an exposure or whether they need to wear a mask in the workplace. And so they can either require proof and keep a copy of that, or they can just ask to see it and then mark down that somebody's vaccinated and not keep a copy of their vaccine card, or they can allow the employee to self-attest that they're vaccinated. So in pretty much all settings, there are a few options, but we do need to require masks for those who are unvaccinated.
Right. But still pretty much on the honor system.
It can be. A business can choose, or a venue can choose whether it will be on the honor system or if they want to require some form of verification. But the honor system is allowed. I know that raises some concerns in some people. I think there's a couple of things that I say to counter that. One is that across the country, the CDC issued its revised masking guidance in the middle of May. And so in most other states, masks have not been required for unvaccinated people, or it's been on the honor system, and we haven't seen surges in cases. So that's reassuring. And also here in Yolo County, our case rate is very low right now. So even if somebody were to be untruthful about their vaccination status and take off their mask indoors, the chances that they are infected and infectious are very low. I feel comfortable with allowing the honor system in our businesses.
Mm-hmm. So I guess this can go out to either one of you. Maybe let's start with you, Dr. Sisson. It seems like it's taken a couple to a few weeks for all of the various different health agencies to decide on how much to ease up on restrictions. But what systems are in place right now if another variant were to come, into the country or develop in the country that maybe break through the vaccine protection? How quickly can these restrictions be put back into place? Like, what systems are in place right now to monitor the situation, and then how quickly can we change gears to protect public health?
Yeah, we can move quickly. The infrastructure that's been developed at local health departments at the state level continues even as we've moved beyond the blueprint. We're trying to scale down our staffing, for example, who do case investigation and contact tracing, but they aren't all going back to their day jobs. We will continue to have a robust COVID response team at the local health department. So if we do see an increase in cases, we will be able to respond with case investigation and contact tracing. And all of the testing sites are continuing, so that we will be able to monitor whether there is an increase in cases. And so we will know, and we'll be able to take action. We still have, local health departments have emergency powers to control infectious diseases. I, as the health officer, have powers to do what I need to do to control infectious diseases in Yolo County. So if we see an increase, we can absolutely issue new orders if we feel those would be appropriate. But we're, knock on wood, hopeful that we may see a small increase in cases as a result of the reopening, but we don't anticipate a large surge. But we continue with our infrastructure in place to be able to handle such a surge if it were to come.
Dr. Blumberg, anything to add?
Yeah, I feel confident that we could certainly, reinstitute any kind of restrictions if there's another wave or another surge. So I feel confident in that.
Mm-hmm. We have a viewer, Amy, who's watching on Facebook, asks, could you please address the cases of heart inflammation linked to COVID vaccination?
Yeah, I've seen several cases of those. And of course, it's the heart. So we're very concerned about that. It's very scary for the parents. But what I can say is that it's been very mild. So these cases typically occur in boys more than girls, in teens, and it's 2 to 4 days following the second dose of the vaccine. So in this age, it's the mRNA vaccines, the Pfizer vaccine. And they've been very mild. The kids are usually hospitalized for 3 or 4 days. They're given treatment for their chest pain. We follow their cardiac enzymes. They go up, indicating inflammation of the heart, and then they come down and they go home. Sometimes the heart function is not affected at all, and that's tested by the pediatric cardiologists who can do an echocardiogram, an ultrasound of the heart, or other tests. And that's most cases it's not affected. In some cases, there's mild decrease in function, but not enough to really require excessive support, like ICU level support. So it's very mild, and it's much different than the cases we see with acute COVID infection. So COVID infection itself can cause inflammation of the heart, and that is more severe. It's typically more severe, requiring ICU care and requiring care to support the blood pressure and other measures. So this is a rare side effect. We're continuing to recommend immunization because it is rare and it is mild, and it's clear that the benefits of vaccination outweigh the risks of the side effects. But of course, we want to learn more about this, and we'd love to prevent it.
Right. And so the way it presents is what? The symptoms are what? They're feeling pain in the chest?
It's generally chest pain and shortness of breath are the two most common symptoms that the kids have.
Right. And as far as how rare it is, how rare is it?
We don't have great numbers. The best numbers we have are from an Israeli study, and it appears to be less than one case out of every 20,000 vaccinations, but we don't have great numbers on that. So there's continuing research.
Right. Okay. Alex, who's watching on YouTube, asks, is there data talking about the percentages of unvaccinated people who are unvaccinated because of a lack of local vaccine availability versus the percentage of people who are unvaccinated due to vaccine hesitancy?
Yeah, it's a great question, and one we can't really answer. There is a fair amount of polling that is happening, but we aren't able to get great resolution into the reasons why people aren't vaccinated. We anticipate or think that some of the reason is lack of access, and in other cases it's hesitancy because there may be a misunderstanding about how the vaccines work, what they do and do not do, and then other people are kind of very resistant, not just hesitant, but they've made up their minds and nothing's going to change their mind that they won't be getting a vaccine for various reasons. So what's really hard is to tease out the numbers for who is hesitant and would benefit from outreach and education and one-on-one conversations with a trusted provider or messenger, and who just needs the vaccine to be more convenient for them. I expect that we have a mix of both in Yolo County, and we're trying to cover all of our bases. So we've made multiple attempts to make vaccines as convenient as possible, offering them at various hours of the day, moving our vaccination sites so that there will always, on a rotating basis, will be in every city and hopefully in most neighborhoods. We've done smaller events at grocery stores, targeting particular ethnic communities, for example. And we have a program right now where residents can call the county and have a vaccine delivered to them, to their home or to their workplace. And so we offered that last week, and we've continued it for another week. So we're trying to remove any barrier to access. So if somebody doesn't have transportation, even though there's now free transportation through Uber and Lyft and Yolo Bus to vaccine sites, if let's say someone is at home with kids and it's too much of a hassle to get to a vaccine clinic, or if they're at work and don't have time off, we will come to you, to your home, to your workplace, wherever you are, and get you a vaccine. So we're trying to get the word out about that program. Residents can call 530-666-8665 to schedule that vaccine. And we really, we're trying to do everything we can to reduce the barriers. And then we're working with community-based organizations who are trusted messengers in their community, who have the cultural and linguistic competency to have the conversations about what is true and what is not true about the vaccines, and meet people where they're at to provide education and outreach, and hopefully over time convince more people to get vaccinated.
Speaking of vaccines and hesitancy, so there's a new vaccine over the horizon, Novavax. I believe it was reported that it might get emergency use authorization by September or so. Can maybe Dr. Blumberg, can you talk a little bit about that vaccine, how it works, and whether or not the nature of this Novavax vaccine might appeal to some of the people who are hesitant with the mRNA vaccines?
Yeah, it might. So the Novavax vaccine is different because it's more of a traditional protein-based vaccine that we're familiar with, like a tetanus shot, for example. The spike protein, which is key to all of the vaccines, that's made in a cell culture, and then it's harvested and purified and put into the vaccine. So there's no mRNA, there's no DNA like the Johnson & Johnson vaccine. So it is more traditional. So people who may not be comfortable with the newer platforms, maybe they'll be more comfortable with the Novavax vaccine. It looks very similar in terms of the protection it provides, about 90% efficacy, similar with the side effects, and that it's generally well tolerated. It's 2 doses, so if people have a fear of needles, there's choices out there, and then they can choose the Johnson & Johnson, which is just 1 dose. But for people who are hesitant about these mRNA and DNA vaccines, really, you should just, I recommend they look at the data, because the data is all publicly available. These platforms have been in development for years. It's not that they are new vaccines in a sense that they haven't been deployed widely before, but these vaccines, these platforms for the vaccines have been looked at for years, just in case there was a pandemic like we had, so we could plug the spike protein into the vaccine and get these vaccines out there. So, it's really amazing what you can do if, like, government and public health and private companies all spend billions of dollars and drop everything and have unlimited resources to develop things. You can get these vaccines out there really fast. But these vaccines have been well tested, and more than 300 million doses have been administered in the US, and more than 2 billion doses worldwide. So we've got a lot of experience with these vaccines.
Right. Lori, who's watching on Facebook, asks, do immunocompromised individuals need to take different precautions even if they are vaccinated?
Yeah, I'll take a stab at that one. I do recommend that people who are fully vaccinated but are immunocompromised, that they behave like they are not vaccinated, in the sense of continuing to wear masks in settings, taking precautions, trying to distance, because while you may be fully vaccinated, you may not have mounted a strong immune response against the vaccine. And we have seen instances where people have, even though they're fully vaccinated, because they were immunocompromised, they ended up with severe COVID infection. So it is important to take additional precautions. Hope that the vaccine protects you, but in some ways, protect yourself as much as you can by avoiding situations where you're more likely to come into contact with those who are infected.
Right. And there's nothing wrong with wearing a mask if you are vaccinated and you don't feel like you're immunocompromised, right? There's no reason not to wear a mask at this point. I mean, it's just an extra layer of protection.
Exactly. People will sort of find their own comfort level who are fully vaccinated, and now they have the option to take off their mask. But if they feel more comfortable keeping it on, particularly as we move into fall and winter and we're in cold and flu season, that mask is going to protect you against other diseases. We, sometimes over the last year we've been operating like COVID is the only thing that we need to protect ourselves against, but we have, through our masking, been protecting ourselves against other diseases, and some people may want to continue doing that. It was really nice not getting a cold over the last year. So the state has made it very clear in its face covering guidance that nobody can be denied service or discriminated against for choosing to wear a mask. So that is absolutely an option that will continue to be available to everybody, regardless of their vaccination status.
I have to say that personally, I haven't figured this one out yet. And maybe I'm too worried about the optics, but I am fully vaccinated. And I'm concerned about going into the grocery store or the farmer's market, even though it's outdoors, but it's it's pretty crowded. You're close to people, and being without a mask. It just feels weird to me after taking all these precautions. And on the other hand, I don't want people looking at me and saying, "Oh, he's wearing a mask, so he must be unvaccinated." I really haven't figured out the optics to this yet.
Yeah, I agree. I mean, I must say, like on June 15th, I went out to the grocery store and I was really concerned. I was wondering, is everybody going to be maskless? And I have to say, I only saw one or two people without a mask outside, and maybe one in the grocery store. And I agree. I kind of personally, I just feel like, better safe than sorry. And by wearing a mask, you're also making it less uncomfortable for people who have to wear masks to wear a mask. So it just doesn't hurt to at least continue for a while. Let's see, Megan from Facebook is asking, is there an estimated date that vaccines may get emergency authorization use for children under 12 years old?
I've heard the fall maybe would be the earliest time. The studies are in progress in children. And so that I've heard for 5 years and up, maybe in the fall, and for less than 5 years, probably sometimes next year, but it's really hard to predict. Obviously, it depends on the results of the studies. I mean, they need to be proven that they're safe, and they need to be proven that there's a good immune response in that age group. And of course, as you go down in age, the children's immune systems are different. With some vaccines, they have better immune responses. With other vaccines, maybe not so good. And we need to make sure we get the dose right. As we get lower in age, the weight of the children on average is less. So we don't want to give them too big of a dose, and we want to make sure it's enough. So it needs to be just right.
Amy again on Facebook is asking, will distance learning still be in effect in the fall for K-12 students enrolled in Yolo County and Davis Joint Unified Schools?
Yeah, well, I can speak to what the governor has communicated. The governor has indicated that students in K through 12 schools should be back in the classroom in person, full-time, 5 days a week in the fall. Some districts may choose to continue some level of distance learning, typically at the district level. They talk about distance learning academies, so it wouldn't be happening on every campus because the teachers will need to be back in the classroom with the majority of the students. I can't speak specifically to what any of the districts in Yolo County have decided to do in terms of whether they will continue to have a distance learning option. But my understanding is that they're all planning to be back in the classroom full time for the fall. We are awaiting revised guidance for K through 12 schools from the California Department of Public Health, so we don't know yet what the requirements will be for masking, for example, whether fully vaccinated students and staff will be able to take off their masks. Right now, everyone's required to mask, but we don't expect that distancing will be required because we can't have all the students back in the classroom and still have them 3 to 6 feet apart. So, it will become more important to use other protective layers if we don't have distancing in place. And so masking, at least for those who are unvaccinated, but also ensuring that we have good ventilation systems in place in the classroom. And then those who are eligible to be vaccinated, getting vaccinated. And of course, staying home when you're sick is a very important thing to keep doing. And then they'll also be screening for symptoms to make sure that no one is coming to school sick.
And I'll just add that we've got experience before vaccines were available that schools are very safe places for children to be. Even before vaccination, there was very little transmission in schools to children or from child to child or child to staff. And really most of the transmission that was found to occur in the school environment was from adult to adult, from teachers or administrators who were not following the masking and distancing advice. So for example, they had meals together, not socially distanced with masks off. So we do feel that the schools are a very safe environment. And of course, it's critical for children's development. The isolation among children has just really had devastating effects on their mental health as well as their development.
Mm-hmm. Mm-hmm. Donna, who's watching on Facebook. Oh, I'm sorry. Did you want to add something?
Oh, I just wanted to echo that. I know some parents are nervous about having kids back in school in person. I think, what we've seen in Yolo County over the last month or two is what Dr. Blumberg just described. We have not seen much transmission in the classroom, in school transmission. It's really people bringing cases in from the community, but they're not spreading within the school. So the school is a safe environment, and it's so important to get our kids back in the classroom, interacting with each other. There's so much that happens on campus besides learning in terms of that social and emotional development and social connection. And we have seen increase in mental health conditions in children as well as adults, but it's so important to have our kids back in the classroom. And the benefits of being in person on school campuses tremendously outweigh the risks from COVID.
Yeah, the CDC just published in the past week that, among girls 12 to 17 years old, there was a 50% increase in emergency department visits for suicide attempts during parts of the pandemic. And it's felt to be due to the social isolation. So it's really critical for children to have normal interactions with their peers.
Right. I mean, it's so important to remember that there's a mental health aspect to this as well as a physical health aspect to this. Yeah. Donna is asking, is there a blood test to take for the immune response to the vaccine?
Well, there are blood tests that can tell you if you've developed an antibody response, and they can differentiate between the response to the vaccine and the response to infection, because of course the vaccines only contain the spike protein. But there's other antibody tests that can test antibody to the nucleocapsid, which you would only have antibody to that if you were exposed to the virus itself, not the vaccine. But what we don't know is what it means if you detect antibody. We don't have a level of antibody that says it's protective or not. We don't even know if antibodies are protective or if a different arm of the immune system, cell-mediated immunity, if that's what's really important for detection. So even if you don't develop antibody that's detectable after vaccination, that doesn't mean that you're not protected. Some of those patients are protected too, and we know that from the vaccine trials that not everybody had a good immune response, and yet the protection was 90 to 95% for the mRNA vaccine. So we just don't know what it means. So we're not recommending post-vaccination blood tests to test for that.
Right. I know some of the messaging as we were going into vaccination that didn't make it to the top of the messaging was that people shouldn't be taking, say, Tylenol or Advil before their shot. Afterwards is fine, but not before. So for people who may have taken, say, an Advil or a Tylenol before their shots, there was some concern that maybe the immune response would not be as robust as it would be if they hadn't taken it. So do we have any more data on that? Do we know anything more about taking those things before the vaccine?
Yeah, I'm not aware of any data on that. It's mostly based on theoretical concerns with other vaccines. So other childhood vaccines If the children prophylactically took anti-inflammatories such as Motrin or Tylenol, they had a mildly decreased antibody response. We don't know if that was clinically important, if that led to like less protection or not, or if it was so minimal that it had no effect at all. So it's a really a theoretical reason not to take it prophylactically. So we're still not recommending that before getting vaccinated, but if you do develop symptoms after vaccination, fever, a sore arm, headache, then certainly make yourself feel better and take an anti-inflammatory afterwards.
Right. And I guess so. And as far as adults go, people are just, scientists just extrapolating the theory that we know about children, right? Okay.
Right. It's all a theoretical thing.
Right. Okay. Alex, who's watching on YouTube, asks, is it likely that we will see an annual COVID-19 vaccine?
I would guess so. I mean, for these kind of vaccines, immunity is likely to wane over time. I don't think that we're going to eliminate COVID. I think it's out there. It's so widespread in the world that I think I'm hoping it's just going to be a seasonal virus like influenza, and then we'll just learn to live with it. And probably get periodic boosters. I don't know when those boosters are going to be needed, if it's going to be yearly or every 2 years or every 5 years, if the immunity that we get from the shots are protect against all the variants, or if they need to be updated to include the variants. And so all those things are questions that we're still awaiting answers for.
And looks like we are done with our viewer questions. So just to kind of wrap up, are either of you concerned about new variants possibly breaking through the vaccines?
I think we've seen that COVID is sneaky, and it is evolving. It continues to attempt to evade immune response, to mutate, as all RNA viruses do, just as part of replication. But we have seen variants that are concerning in terms of becoming more infectious. Particularly with I think it's now called the Beta variant, or the South African, the B.1.351. There are more concerns about immune evasion. Fortunately, we've seen that the vaccines, by and large, are effective against the variants that we currently have. But we could, see new variants evolving that the vaccines do not work effectively against. And I think that's why we have this sense of urgency to get people vaccinated, not just in the United States, but around the world. The longer we let COVID replicate in large numbers, the more opportunities it has to mutate and to create a variant that could be resistant to the immune response through vaccination. So that worry will be out there until we have worldwide herd immunity against COVID, which may not happen. So I feel confident about the vaccine's ability to work well against our current variants, but I do worry that something could come up down the road that our vaccines may not work against.
Dean?
Yeah, it is a concern, and we've talked about herd immunity. It's a constantly changing goal, though, because of the variants. So we talked about you need something like 70 or 80% immunity within a community to result in herd immunity. And yet, if you've got a virus that's twice as infectious, well, then that number goes up. So, that's why we've seen a lot of talk away from herd immunity and just that you need more people immune. And the whole thing with herd immunity is that just means that it doesn't mean that there's going to be no infections in a community. It just means that there's limited transmission within the community. So the more people that are immune around you, the less chances of getting vaccine breakthroughs and continued transmission. That's why it's important for the efforts for public health in Yolo County, that going door to door and delivering vaccine. That's why these efforts are so important, to get as many people immune as possible, because it's not just on a countrywide level that we need immunity, or statewide or county. I mean, it's by zip code, by census tract, that we know that when you have pockets of people who are susceptible, you're going to get transmission in those pockets. We know that for COVID, we've known that for measles. So we know that for other infections too, that the more people who are susceptible, the higher the risk of transmission within that community. So that's why it's so important for everybody who's eligible to be vaccinated.
Right. So why don't we wrap up with your final thoughts from both of you on what is the state of the pandemic right now, and what are your thoughts on the outlook?
Well, I think that we're in a good place right now with the pandemic. I think the outlook is good. The vaccines have worked extremely well. In terms of getting more people vaccinated, in terms of those who are hesitant, I think we're just starting to see the traditional public health messaging to communities that might be hesitant for various reasons, for historical reasons where they've been marginalized, and that we need people within those communities to be credible spokespeople to speak to those communities. We need messaging that resonates with those communities. Traditionally, the federal government has developed these materials, and then the state and local health departments have customized them. And the Fed was a little bit behind on that. And so these are just coming out now. So I'm optimistic that these efforts will be successful.
Yeah, you stole the word right out of my mouth, and that is optimistic. I think as I look back over the last year and a few months since the pandemic began, we have come so far in terms of what we've learned about the virus, in terms of how it spreads, how to control it, how to treat people who are infected, how to prevent it, particularly with vaccines. So I'm really hopeful moving forward as we enter this beyond the blueprint and the reopening, that we've got our case numbers low. We have a large proportion of the population vaccinated. So I feel like we are in a good place. However, I don't want us to be complacent, and I'm not complacent. We still have work to do in Yolo County, particularly when it comes to vaccinations. We've gotten the easy folks, the low-hanging fruit, but we still have 45% of residents who've not received a dose of vaccine. And that means that 45% of residents of Yolo County are still vulnerable to infection, hospitalization, and death from COVID. And the variants that are circulating in Yolo County are more infectious. They can cause more severe disease. So people who remain unvaccinated are certainly not out of the woods. And we need to continue targeting our vaccination efforts to our more disadvantaged communities who may have more barriers. And we also need to communicate the facts from trusted messengers about the vaccine, so that we can convince those who are more hesitant to get vaccinated, so that they can have the same protections that those who are vaccinated have. So cautiously optimistic.
I mean, it's great to know that we are in a better place than we have been over the past year, but we also have to remain vigilant. And, it's nice to know that everyone is, authorities, health authorities, medical professionals are remaining vigilant to kind of keep us in this good place. This has really been a great conversation. Thank you so much for coming on today.
Thank you.
Thanks for the opportunity.
Dr. Aimee Sisson is Public Health Officer for Yolo County, and Dr. Dean Blumberg is Professor of Pediatrics and Chief of Pediatric Infectious Diseases at UC Davis Health. Until next time, I'm Satirius Johnson, and this is UC Davis Live COVID-19.